happy spring. The daffodils are blooming, the tulips are popping up. It's about 58 degrees and sunny in my world as I look outside the window. And like a lot of people, I woke up this morning and actually like snow, and I'm ready for spring. And I looked outside and I thought, but context and perspective is an important thing. And I quickly thought about our friends down south and the weather that they are dealing with, and all of a sudden a little snow did not seem like that big of an inconvenience for us. But thank you all for coming today, and welcome to Henry Ford Health System's corporate offices. I'm Bob Riney. I'm the President and Chief Operating Officer of Henry Ford Health System, and it's my pleasure to kick this off. We are here this morning because all of us in this room feel strongly about access to health care. Too often those who suffer from advanced and existing medical conditions cannot find insurance under any circumstances. This discourages and even impedes their ability to seek medical care, and perhaps worse yet, it keeps them from developing a relationship and a care management approach with a primary care physician that can treat them effectively before things get worse. We all know the difference between coordinated care and aligned care, and disparate care and fragmented care. Today's speakers are going to talk about an insurance option that now exists for those with pre-existing medical conditions. What's more, they will also be detailing for the first time new insurance options within that plan that aim to make that coverage not only accessible but affordable. This health insurance program, known as HIP Michigan, is a statewide health insurance plan that provides quality health care coverage to Michigan residents with pre-existing medical conditions. HIP Michigan is offered through the temporary federal high-risk pool created by the Patient Protection and Affordable Care Act, the federal health care reform law, which was passed last year. The program is being funded with an estimated $141 million in federal subsidies, together with subscriber premiums. Healthcare providers throughout the state are being urged to help get the word out about this program for one simple and important reason. It is yet another tool to improve access to healthcare in our state, and an important tool at that. HIP Michigan representatives will be up at the podium shortly and will be sharing details on eligibility, rates, and more. But a refreshing element is that no applicant will be denied coverage or benefits simply because of health status. And we all are aware of the tragic stories of people that have not been able to get any kind of coverage because of pre-existing conditions. The support for such programs is probably self-evident. As you can see by this morning's roster, HIP Michigan also has bipartisan support from the state legislature. And on that note, let me quickly introduce the speakers who are here with us today. From Governor Rick Snyder's administration, we have Olga Dazzo, Director of the Michigan Department of Community Health. Craig Lesley of Physicians Health Plan of Mid-Michigan and an administrator for HIP Michigan. David Seaman, the Executive Vice President of the Michigan Health and Hospital Association. Republican State Senator Jim Marlowe of Lake Orion. Democratic State Representative Fred Deerhall of Detroit. And Eric Schneidewin. Tough name, I'm trying to do reasonably well.
Great.
President of AARP of Michigan. And an individual and a friend and colleague of mine, Joyce Young, Director of the Michigan Office of Nurse Executives. So we've got a wonderful bipartisan effort to do something terrific for Michigan using federal dollars. That is a recipe for success. And I now invite Director Olga Dazzo to the podium.
Thank you, Bob. And yes, we must keep positive about spring is on its way. We know that. And it is just wonderful to see the wonderful snow. It's not going to stick. access to affordable, quality health care. We're working together to move Michigan to a more patient-centered model of care. This will put an emphasis on wellness, improve the quality and coordination of care, and achieve cost savings. And as you hear more about the program, you will see how this is done. Michigan is striving to achieve an improved healthcare delivery model that is affordable, accessible, and efficient. The health insurance program for Michigan, which is, as you heard, is known as HIP Michigan, is helping our state reach that goal. We all know the cost and complexity of healthcare keeps some people from seeking treatment in a timely manner or even altogether. And by people not seeking care, it often results in increased future hardships for their health as well as their finances. The expense and severity of health problems, coupled with complex diagnostic and treatment technologies, can be intimidating, especially for those without insurance. With healthcare costs rising rapidly in a tough economy, it has become more common for people to forego care, postpone procedures, and leave prescription drugs unfilled in order to save money. And we all know that that is not where we want our family members or Michiganders to be. However, postponing procedures leads to greater long-term costs for emergency care and hospitalizations. That's why the HIP Michigan program is so important. Today, 1.4 million Michigan residents are uninsured. We can and must do better. By offering insurance for those who are without, HIP Michigan helps make that possible. We know the two greatest barriers to enrollment in HIP Michigan so far, they are the lack of awareness about this new program and its costs. So hopefully all of you will help us let Michiganders know about this great program, and we're excited to tell you about the reduction in cost we're about to see. So I'm delighted that the U.S. Department of Health and Human Services has approved Michigan's request to offer 2 new plan options with reduced premiums. HIP Michigan's new lower pricing will make this program even more affordable and accessible to Michigan residents who have been denied coverage. And that's, of course, good news to all of us. Now, I would like to invite our next speaker, Lesley, who administers the HIP Michigan program, to come to the podium. Craig will provide you with more details about the new changes to the HIP Michigan plan. Thank you.
Thank you, Director Dazzo, and thank you, Bob, and your team here at Henry Ford Health System for hosting today's press conference, and thank you all for being here today. As Director Dazzo mentioned, we have great news to announce today regarding the state's HIP program for Michigan. After some negotiations, the U.S. Department of Health and Human Services has approved the introduction of 2 additional HIP Michigan options beginning May 1st, 2011. This decision by the federal government will make available lower monthly premiums for eligible enrollees without reducing the benefits of the program. A recent analysis by the federal government shows that 129 million Americans under age 65 have some type of pre-existing medical condition. Examples of a pre-existing condition in the historical insurance world are heart disease, cancer, diabetes, high blood pressure, and arthritis. Older Americans between ages 55 and 64 are at particular risk. Up to 86% of people in that age bracket live with some form of pre-existing condition. As many as 30% of people under age 65 who are in perfectly good health today are likely to develop a pre-existing condition sometime over the next 8 years. Up to 1 in 5 Americans under age 65 with a pre-existing condition, 25 million today, are uninsured in the United States. These are the people that the HIP program or health insurance program for Michigan are designed to help. It's estimated that over 3,500 people here in Michigan are certainly potentially eligible, or in the first tier of people eligible for this program, and that number could go even higher depending on your definition. If you know somebody who is unable to obtain health insurance due to a pre-existing condition and who has been uninsured for at least 6 months, they need to know about the HIP Michigan program. Number one, HIP Michigan is accessible. The coverage is available to all Michigan citizens on a first-come, first-served basis. This is great news for Michigan residents who are unable to obtain quality, affordable care because of a pre-existing medical condition. And HIP Michigan is affordable for patients who cannot get insurance today because they have a pre-existing condition. HIP Michigan offers affordable coverage for them rather than face financial ruin that typically come as a result of medical expenses when you're uninsured. Premium payments for HIP Michigan are about the same as what an average person would pay for the individual health insurance market. The premium costs do vary by age in this program as prescribed by the federal government. The key difference is that the HIP Michigan program includes, as opposed to exclude, coverage for pre-existing conditions similar to the ones I described earlier. HIP Michigan can provide critical access, in some cases life-saving access, to health insurance and provide relief to those who have struggled to find affordable coverage. The new plan offerings being offered effective May 1st make the program even more affordable. The three programs that are covered now, and you have information in your chair, we've got more copies I'm sure that are available, describe the three plans with the three pricing ranges that are now available. Up until May 1st, only Plan 1, or the first plan, we only had one plan to offer, and now we'll have three. The plans vary not in terms of what's covered, but only in terms of what the front-end deductible might be. And by increasing the deductible a little bit at the front end, we're able to offer these two more affordable plans. And as we know from the more than 1,000 applications that we've received at PHP through this program so far, price has been the biggest, or cost has been the biggest barrier to enrollment. And we've worked hard, as our staff has worked hard with the Department of Community Health to come up with these options. So currently the least expensive plan for 19 to 24-year-olds is $181, and it has a $1,000 deductible, fairly standard in business today. But now under the new plans, we'll be able to drop the price from $180 to $130 a month if you accept a higher front-end deductible, and all the way down to $109 for those who accept the deductible of $3,500. And in the insurance world today, or health insurance world today, many commercial programs, programs offered by normal employers or regular employers today are offering programs very similar to this nature. So this is a real health insurance program, except for the advantage of the pre-existing conditions. It's something that we can all be proud of in terms of what's covered in that program. The most expensive premium today for 60 to 64-year-olds is $686, and that'll drop down to $415 per month for people that opt for one of the new options. Co-pays are $20 for a primary physician office visit, and $30 for a specialist office visit, and $100 for emergency room visits. Again, fairly standard in today's group insurance market. And prescriptions are covered with co-pays for generic prescriptions at $10, and brand name drugs are also available. You pay more, either $30 or $50, depending on the nature of the brand name drug that is needed. It provides peace of mind. For people in their 60s, paying even $600 a month is better than paying $25,000 or more for health insurance, which they would typically be exposed to with programs that are offered in the regular commercial market. HIP Michigan reduces the stress and anxiety of going without health insurance and eliminates the worry of wondering whether a doctor will see you. Because of HIP Michigan, people are already booking doctor visits, surgeries, and treatments like chemotherapy that they've long delayed because they've had no way to pay for them. The stories that we get every day on the phone in our office make the individual human interest stories make clear the importance and the value of this program to these people. And finally, HIP Michigan is comprehensive. As I've suggested, it offers complete coverage, and HIP Michigan provides many, if not all, the same benefits a patient would get from a private health insurance plan offered by the many companies that are offering those programs in Michigan today. Coverage includes the medical office visits, as I mentioned, prescription drug coverage, emergency care, hospital coverage, home health care, wellness services, and behavioral health services. Most Michigan medical providers and pharmacies participate in HIP Michigan. The provider network that we use in the mid-Michigan area is the Physicians Health Plan Network. Outside of that area, we kind of wrap that, if you will, with the Cofinity Network, which is a comprehensive network of Michigan physicians, hospitals, and other providers commonly used by other plans here in Michigan. If a patient is unsure whether a provider is in the HIP Michigan network, they can check on our website, which is provided in this brochure, which is hipmichigan.com, or call HIP Michigan Customer Service at 877-459-3113. And we're convenient. It's easy to find out about the plan on the website or by calling us, and we are available from 9 a.m. to 5 p.m. every day, and we process applications very quickly. And if an individual is eligible for enrollment and submits a complete application, the required documentation and premium payment for the first month by the 15th day of that month, the approved applicant will have coverage taking effect the first day of the following month. So we are open for business. We've enrolled over 245 people in this plan already, and we're ready, willing, and able to take on as many more as apply. They will receive care in an appropriate setting as you would at any other health plan. And it's a good program, and we know that we've helped all 245 people that are in this plan already, again, from the human interest stories that you typically get involved in as you help people navigate through the healthcare system, as our nurse assistants and our pharmacy people are on the phone and making it work as easy for them as possible. So with that, I want to thank Bob Riney and Henry Ford Health System for hosting this press conference, and I want to thank also the many people that have worked together as a team to make this organization happen, or this program happen. And that includes the Michigan Health and Hospital Association, members of the Michigan Legislature, AARP of Michigan, the Michigan Pharmacists Association, the State of Michigan Office of Financial and Insurance Regulation, the Michigan Association of Health Plans, the Michigan Primary Care Association, the Michigan Organization of Nurse Executives, and of course, Ms. Dazzo, the Michigan Department of Community Health. And with that, I'll be around as my assistant, Mary Ann Sesti, will be to answer questions. But now I'd like to turn over the microphone to Mr. David Seaman of the Michigan Hospital Association.
Thank you, Craig, and good morning, everyone. For those who know me, you know I grew up in Buffalo, New York, so as I look out the window this morning, it looks like any other spring, so what are we talking about? The mission of community hospitals is to provide high-quality health care for all who walk through their doors, regardless of their ability to pay. Often, patients without health insurance delay needed care. As research has shown, too many people are hospitalized with severe medical conditions that could have been prevented or addressed at an earlier stage. Additionally, the medical bills that result from these encounters are often higher than patients can afford and ultimately result in the shifting of costs to others. That is why the MHA is working with hospitals throughout the state to encourage patients who are eligible to consider enrollment in HIP Michigan. Henry Ford Health System and other hospitals recognize the importance of ensuring access to care. Henry Ford demonstrates that through various programs, including the mobile medical clinic for medically underserved children. As a matter of fact, ensuring access to care is a priority for all Michigan hospitals, and a number of them have joined us this morning to show their support for programs like HIP Michigan, helping to connect people with coverage. Joining Henry Ford this morning include representatives from Beaumont Hospitals, Detroit Receiving Hospital and University Health Center, the DMC Children's Hospital of Michigan, Doctors Hospital of Michigan, Hospice of Michigan, Carmanos Cancer Center, Oakwood Healthcare, St. John Providence Health System, and the Sparrow Health System. The economic pressures faced by our state citizens continue and increase every day. As community stewards and wellness advocates, Michigan hospitals are committed to doing what they can to raise awareness of the opportunity that HIP Michigan provides, the chance to address chronic and debilitating diseases, to save lives, and to make care more affordable. HIP Michigan is not only good for patients and the community, but also for hospitals, who are continuing to struggle with costs to cover care that are not reimbursed. In 2009, Michigan hospitals provided $317 million in charity care provided to those with no capacity to pay, and an additional $565 million in care qualified as bad debt. Individuals were unable to pay all or any of the costs, causing us a total of $882 million in uncompensated care in Michigan hospitals. Programs like HIP Michigan help create an access point to the healthcare system, linking the chronically ill to the necessary primary care they need and that they deserve. In addition to this more comprehensive approach to health management, HIP Michigan helps to reimburse hospitals and doctors for the care provided, thus reducing the mounting bad debt that threatens the existence of hospital services, and in fact, the operation of hospitals themselves. Patient enrollment in HIP Michigan will assist Michigan hospitals to continue to provide high-quality, cost-effective care while reducing the financial burden on the communities. To help awareness about the state's new high-risk pool, the MHA is getting the word out to member hospitals, employees, and their patients about HIP Michigan and distributing this brochure. Along with that brochure, which is being made available to hospitals, HIP Michigan posters and flyers have begun to be displayed in hospital emergency rooms and waiting areas. Expanding access to health care through programs like HIP Michigan is a unique opportunity to ensure that those who need treatment the most can afford it and receive it at the right time and in the right setting. The MHA and Michigan hospitals look forward to their continued efforts to embrace this program, raise awareness, and get people covered. It's now my privilege to invite Senator Jim Marlowe and State Representative Fred Durham to the podium.